Thank you for your interest in Vet NeuroJar. Although we do our best to summarize veterinary articles, it does not supplement the actual article, and if you are able to download and review the article yourself, please see the link in the description. This will summarize the article titled, Clinical Features and Outcome of 10 Dogs with Suspected Idiopathic Vestibular Epilepsy. Vestibular epilepsy (VE) is a condition where the main symptoms are focal seizures with signs of vestibular disease. The duration ranges from a few seconds to several minutes. In humans, the vestibular cortex plays a role in postural functions and eye movements and is predominantly located in the temporal and parietal lobes. EEG studies show interictal spikes and sharp waves at the parietal and temporoparietal occipital junction areas. The responsiveness to anti-epileptic treatment is high. Differential diagnosis in VE includes vestibular paroxysmia (VP), which is characterized by spinning or non-spinning vertigo that lasts from seconds to minutes. 2 dogs with VP have been studied, one with suspected transient ischemic attack and the other with an atypical form of Meniere's disease. Discriminating between VP and VE can be challenging. A diagnosis of VE is supported by abnormal EEG findings and responsiveness to anti-epileptic treatment. Veterinary medicine reports vestibular syndrome associated with peripheral or central vestibular dysfunction resulting from various causes. Clinical signs do not recur as in epileptic seizures. This study aims to define the clinical features, phenotypical manifestations, and outcome of dogs with suspected VE. This study examines the cases of dogs presenting with recurrent episodes of vestibular disease of suspected epileptic origin. Further investigations include MRI and CSF analysis. The clinical signs range from mild to severe ataxia, hypermetria, nystagmus, and head tilt. Treatment with anti-epileptic medication significantly reduces the frequency and intensity of seizures. The study concludes that vestibular epilepsy is a recognizable focal epilepsy in dogs that responds well to anti-epileptic treatment methods. A retrospective study was conducted to search for medical records of dogs with suspected vestibular seizures, or VP, referred to Veterinary Neurological Center La Fenice Cagliari, Italy, and Department of Veterinary Medical Sciences of the University of Bologna, Italy, between January 2009 and May 2023. The inclusion criteria were 1. Complete and comprehensive medical records of signalment, history, neurological examination, and diagnostic findings. 2. A normal neurological examination by a board-certified veterinary neurologist AG or veterinary neurology resident in training TA. 3. A history of at least 2 vestibular episodes of sudden onset and abrupt ending lasting from a few seconds to minutes, occurring at least 24 hours apart. 4. At least 1 episode documented by video recording. 5. Exclusion of reactive seizures by the evaluation of normal laboratory results. 6. The absence of abnormal brain MRI or CT exam results. And 7. A minimum follow-up of 10 months from presentation. Dogs with additional generalized tonic-clonic GDC seizures were also included. Information collected for each dog included signalment, anamnesis, drugs administered before presentation, diagnostic investigations performed, medical treatment, results of brain MRI or CT exam, and clinical outcome. The MRI and CT images were evaluated by a board-certified veterinary neurologist AG. Follow-up information was obtained by medical records, telephone interviews, or clinical re-evaluation. Clinical improvement was defined as a reduction in frequency or cessation of clinical signs after starting medical treatment. A reduction of 50% in vestibular episodes has been adopted as a definition of ASM's efficacy in most studies of epilepsy in dogs. Failure to respond to treatment was classified as the persistence of signs of vestibular disease with 50% reduction or increased frequency despite therapeutic intervention. Data regarding euthanasia or death were noted. Results. Animal results. 10 canines were enrolled in the study after meeting the inclusion criteria. Pugs were the most common breed, 50%, with 6 males, 60%, and 4 females, 40%. The dogs' age ranged from 8 months to 13 years old, with the median age being 7. Clinical features. The dogs displayed vestibular ataxia with lateral drifting, rolling, head, tilt, and horizontal nystagmus. Episodes lasted from under 1 minute to 1 hour. They ended abruptly and were followed by immediate recovery without postictal signs. Episodes occurred daily or several times per year. The dogs were responsive to their owners' voices. Investigations and diagnosis. Brain MRIs and CSF samples for the dogs were normal, except for 1 dog that underwent a CT scan and showed no abnormalities. 4 dogs had normal CSF analyses. 2 dogs exhibited both signs of vestibular disease and isolated GDC seizures. More specifically, 1 dog underwent a brain MRI, which was normal, and an idiopathic epilepsy was suspected. Another dog's vestibular episodes ceased after starting ASMs. GDC seizures occurred 3 years later. Therapeutic interventions and outcome. ASMs were administered in all 10 dogs, with 9 receiving levetiracetam and lev. PB was administered in 3 cases, and gabapentin GBP was administered in 1. Clinical improvement was observed in all cases. 5 dogs had vestibular episodes disappear while 5 others had a reduction in frequency or severity of vestibular disorder. 1 dog who received PB solely had episodes decrease from daily to once every 2 months. 1 other dog's vestibular episodes stopped after lev. Unfortunately, the dog died for unrelated reasons. 2 dogs died due to ailments unrelated to the disease. Discussion. This study reports on the clinical features and outcome of suspected idiopathic vestibular seizures in dogs. There is a lack of veterinary literature on this topic. The vestibular episodes reported in all the cases included in this study could be consistent with suspected vestibular epilepsy, VE, or vestibular paroxysmia (VP). The presence of additional generalized tonic-clonic GDC seizures, interictal electroencephalogram (EEG) spikes, and positive response to anti-epileptic therapy supported the hypothesis of an epileptic origin of vestibular episodes. Therefore, it is possible that VE exists in dogs with an idiopathic cause and presentation at any age. The most common breed in this study was pug dogs. This breed may be predisposed to VE, but further studies with larger cohorts are needed to investigate this aspect. The underlying mechanism of VP in human medicine is thought to involve nerve vessel contact, leading to nerve hyperexcitability. Diagnosis is mainly based on clinical features, a high frequency of attacks, short duration, and responsiveness to carbamazepine and oxcarbazepine. Diagnostic imaging could be helpful in identifying a neurovascular abnormality. However, in none of the cases in this study, diagnostic imaging detected a compression of the vestibulocochlear nerve. The duration of vestibular attacks in the cohort lasted from several minutes up to an hour. The treatment treatment of VP in human medicine involves using carbamazepine and oxcarbazepine as first-line drugs, while the first-line drugs used in this study were not sodium channel blockers. Reduction or ending of vestibular attacks without treatment with anti-seizure medications was not observed in any case. However, further studies with larger samples are needed to confirm these assumptions. In human medicine, epileptic vertigo or dizziness is used to describe signs of vestibular disease triggered by focal epileptic discharges. VE has been reported to occur with a low incidence. Clinical signs range from mild disequilibrium to rotational vertigo. The presence of nystagmus is uncommon. Conversely, in this study, vestibular nystagmus was observed in most dogs. In our cohort, GDC seizures were observed in only 2 dogs. EEG activity correlated with clinical signs in some cases, indicating a potential epileptic origin underlying the signs of vestibular disease. In one dog, GDC seizures started later, after the discontinuation of anti-epileptic treatment used to treat VPVE. Interestingly, in humans with VE, pictal interictal EEG studies showed the presence of seizure activity predominantly at the temporal lobe level. The identification of EEG interictal spikes could support our hypothesis of an epileptic origin underlying the signs of vestibular disease. Up to 90% of human patients with VE have a favorable response to anti-seizure medications ASMs. The same outcome was observed in this study. EEG analysis is considered an important diagnostic tool to differentiate suspected seizures from paroxysmal events, although the presence of seizure activity was detected in all dogs receiving an EEG exam. Further prospective studies with a complete diagnostic plan, including EEG exam, are needed to evaluate this aspect. CSF collection was performed in 4 dogs, and this can have led to failure in detecting disease conditions, even in the presence of a normal brain MRI study. However, progression of clinical signs was not observed in any of the cases without CSF analysis, making it unlikely that the dogs had inflammatory, infectious, or neoplastic diseases. This study suggests that idiopathic VE may occur with a low incidence in dogs. However, the small number of cases and the long period covered represent limitations, and further studies with larger cohorts are needed to confirm these findings.